More than 1.6 million people in the U.S. live with a leaky tricuspid heart valve, which impacts their quality of life. The FDA has recently approved a life-changing treatment option. Dr. Nadim Galou from Abbott joins us today to share more, along with Gregory, a patient advocate. Welcome to you both. Thanks for joining us.
Thank
you for having us.
Yes. Let's start with you, Doctor. Doctor, what is a leaky heart valve, and what are some of the symptoms?
The heart valve is when one of the heart valves doesn't close properly, and it allows blood to leak backwards. Some of the symptoms are such that patients just don't feel well. They can get swelling in their legs, swelling in their abdomen, a loss of appetite, a lack of energy, not being able to do the things that normally bring them pleasure. And this occurs because blood is no longer moving forward as it should, and instead it's leaking back. And this can really affect patients' quality of life. And this is what the Abbott TriClip addresses, a minimally invasive procedure that helps to reapproximate the leaflets of the valve and reduce the leaking.
Yeah. And how has it historically been treated?
Historically, patients received medical therapy primarily, and this amounted to diuretic therapy. Diuretic therapy can be an uncomfortable therapy because essentially you're urinating the extra volume away that's backed up, which means you have to be close to a bathroom for frequent visits. The other treatment that was available to patients, and still is tricuspid valve surgery, an open heart surgery which has some risk. And in this patient population, these risks can be increased because of other factors these patients often have. Therefore, it wasn't offered very much. And this is why the TriClip device from Abbott really revolutionized therapy, because it now offers patients something that can be done relatively quickly with a single overnight stay at the hospital with no major incisions, simply a puncture in the skin.
Yeah, let's dive into that a little bit more. Why is the TriClip such a significant advancement for patients living with a leaky valve?
If you think about the therapies that were previously available, an open heart surgery with risk in patients who have additional risk, and medical therapy which really controlled the symptoms but didn't actually address the leaking of the valve. So the TriClip device by Abbott is again placed through a small puncture in the femoral vein of the leg, so at the top of the leg. This vein leads you right into the heart, and you can deliver a small clip which brings the leaflets back together again, and it prevents the leaking. Single night in the hospital, patients are actually up and walking the same day of the procedure, and when they go back to their lives, they feel significantly better, and I think Gregory will share his experience about how it affected his quality of life.
Yeah, so Gregory, what kind of symptoms were you experiencing before you received the treatment?
Sorry, could you repeat that?
What symptoms did you kind of experience before you received treatment?
How did you feel before the procedure?
Oh, thanks. I have a little problem with my earpiece here. Before the procedure, I was very lethargic, didn't have the energy to do the things I was accustomed to doing on a daily basis, had excess fluid building up in my abdomen, shortness of breath, and just felt like I wasn't able to just be me at all anymore.
How soon after receiving the device did you notice a difference?
After I received the TriClip, I felt immediate difference. As Dr. Galou had said, I had the surgery one day, spent the night in the hospital. The next day I was discharged. I went home and I just started walking in my house 3 or 4 minutes at a time. And then within a week, I was able to get out there and start doing a lot of the activities I previously hadn't been able to do, with a little modification, of course, but I was able to get back to my normal state of life.
Yeah, I love that clip of you there playing golf,
Yeah.
getting back to the things obviously that you enjoy and that you love. Perhaps you can fill us in, Doctor, on where we can go, where our viewers can go for more information on this Abbott TriClip.
Your audience can go to abbott.com, where they can learn a lot more about the Abbott TriClip device, but also other Abbott devices which have helped patients and improved their lives. It's a great resource. And if you have any of the symptoms that Gregory described or that we've discussed here, please talk it over with your cardiologist or your primary care doctor and make sure that these symptoms are addressed. Please don't ignore them.
Yeah. Thank you both for your
Yes.
time. Thanks for joining us. Of course,
Thank
thanks to Abbott for sponsoring this segment. We appreciate you. Yeah, that's fascinating.
It
New
is.
advancement in medical technology. I love it.
Really, yeah.
Yeah.